help them guide students like on the route they want to take, and kind of give them advice and tips on what they should do to get there and reach their goals.
Okay, great. So I'll start, but I have to say that I didn't have much prepared, and I hopefully we can make this more of an interactive session rather than me talking away, because I can do a lot of that and then people will get bored. So I'm Shant, Shekherdimian, born and raised in Los Angeles, went to undergrad at UCLA, and then went to medical school in Philadelphia at Drexel University. I came back to do my residency in general surgery. I was an EMT in college, even high school, I think, and was dead set on going into emergency medicine. But during medical school, had a little bit of a change of heart and decided to go into general surgery. So I came back to LA. A little bit of a convoluted story. I started my general surgery residency at Kaiser in Los Angeles. And then I got really, really interested in a field called pediatric surgery, which is pretty self-explanatory, but which also happens to be one of the most competitive fields to go into after surgery. So in order to line things up so that I would have a chance of getting into those fellowships, I went to UCLA to the lab for 2 years. I did 2 years of my general surgery residency at Kaiser, and then I jumped over to UCLA to the lab for 2 years. And then I was offered a spot to stay at UCLA and finish up. So if someone's keeping track, that's 4 years of med school, 7 years of residency. And then after that, I went to Toronto to do a pediatric surgery fellowship for 2 years. After which I came straight back to UCLA, where I've been on faculty now for, I guess, going on 8 years, since 2014. So I'm a practicing pediatrics, well, I was until this big life change last summer, pediatric surgeon on faculty. I'm the teaching faculty, so I work with students, residents, and then have been involved in various research activities at the university as well that are specific to my field. But my big area of non-clinical interest has always been in global health. And I guess within this audience, we don't have to be that generic. It's about healthcare in Armenia, not global health. So my interest and passion has always been to be involved in Armenia through the perspective or prism of healthcare. So I guess we can jump over to the personal side. I came to Armenia first time in 1997, and then probably for that first decade afterwards, I would come every year, and then it was gradually escalated to the point that I would come 1 week out of every month until last summer. Of course, the years of residency and fellowship, I mean, that was much harder to do, but nevertheless, all 4 weeks of vacation during residency, I would spend out here. And then last year I had this amazing opportunity come up where I was basically afforded or given an appointment to come here and serve at the Ministry of Health. So I'm now an advisor at the Ministry of Health here in Armenia, and we moved here with my family. I do a little bit of coming back and forth, particularly during the winter holiday in the summer, so that I can maintain my job and my skills and keep up with my patients and all of my clinical duties. But then the rest of the year we've been here. So we're now completing our first full, I guess, academic year. The kids have a couple more weeks of school until summer break. We'll be out in LA for the summer, and then we'll return in August so that we can start year 2 of this new arrangement. What am I doing here? So technically, like the title is that I serve as an advisor to the Minister of Health. In practicality, I've been involved in a few sort of big projects, and then there's a sprinkling of other things that I've been working on. The big projects are developing a strategy for primary care reform. We can get into this if this is interesting, but at some point you guys will probably have to tell me to stop talking about the intricacies of problems in healthcare in Armenia. But because Armenia inherited the healthcare system from the Soviet Union, where there was basically no primary care, everyone was a specialist. We now have a very underdeveloped primary care system, which makes for a very inefficient and very expensive system. So we're trying to create a roadmap and a vision for where we want to be with primary care, making it the center of the healthcare system, which will have all these sort of downstream effects as well and help improve the non-primary care system as well. The other one is a task force that's in charge, a task force that I'm a part of that's in charge of creating a strategy for improving the quality of care. So this one I will take a second to go into details, because I imagine that you guys are on this call because you're interested in some specialty or some career in medicine, and you probably are also wondering how that can overlap with your interest or your background in being Armenian. So there's one statistic that I wish every single Armenian who's interested in healthcare knows about, and I wish every single Armenian who does something or wants to do something in Armenia makes sure that they can help address. And then to sort of think backwards from that, understand that most of what we do as a diaspora actually doesn't address the main problem in healthcare. So the statistic comes from an article that was published in The Lancet. I think it was maybe 2018 now, or maybe 2019. And it showed that more people in Armenia die because of the healthcare that they receive, because of the care that they receive, rather than not having access to care. And if we think about this, most Armenians think that Armenia, whether that's here in Armenia or in the diaspora, put Armenia in that big global health basket that I mentioned earlier, and they think that the issue is access to care. If only we were doctors, we were good doctors, and we came here to operate for 2 weeks. If only we can have another fundraiser and raise money and send machine X to Armenia. In fact, we have a surplus of those things. We have too many doctors for the population that we have. We have, for example, more MRI machines per capita than most European countries. But the way that the diasporan Armenians has engaged in healthcare hasn't transitioned from this access issue, which is coming here and providing access to surgeries by doing a mission or sending stuff, to a quality issue. We're understanding that we have the stuff that we need. We just have to make it work better. We have to make sure that whatever is being delivered is of higher quality care. So I think that this is a really important thing for all of us to keep in mind when we think about how we can possibly engage in healthcare in Armenia. Now, having said that, that's a very, very, very hard, because the easy thing is to accrue your vacation and come here for the 1, 2, or 3 weeks and deliver what you ultimately will be best at doing. The issues or trying to address issues of quality or organizational or governance issues are much harder to do, particularly if we are, not able to pick up and leave and move here. So, but it's not impossible to do. And there's many of the examples of people who have been able to do that by having a good understanding of what the issues of healthcare in Armenia are, where the burden of disease lies, where the cost-effective interventions can be, what has been proven to be effective in other places, making good contacts and relations, because we also have to get out of this mindset that we can come in and quote unquote be the saviors. In fact, partnership and collaboration is the way other countries have made progress in global health, and we need to be doing that. And so it's not impossible, but it'll take the recognition and understanding that it's not going to be as, if you want to call it, as sexy as doing the medical mission or the emergency surgeries or anything like that. But it is going to be things that are going to have the bigger impact and are going to make the sustainable changes that the country needs, so that ultimately they can have a system, we can have a system that will be able to fly by itself. So, well, why don't I stop there? And see if we can make this a little bit more interactive. Happy to dive into any of the components of my career that you guys will find interesting, and then we'll take it from there.
Hi, Dr. Shekherdimian. My name is Rafiq.
Just call me Shant, everyone. Hi. Just call me Shant. Hi, Rafiq.
Hi, Shant. I've met you before. I think I remember at the Medical Society meeting. I think at that time you were working at the colon cancer screening research, and I was very fascinated by your presentations at the Armenian International Medical Meeting, whatever. But my question is, I know you have more job on the ministry side, but are you still actively kind of doing research as well? Or, and my second question would be, if so, let's say if a resident would want to come to help you out in Armenia, is there any pathway for that for us to kind of help you any way we can?
Yeah, great question. So before the move, I was involved in some research on the clinical aspects of my specialty. So we're doing some research at UCLA on conditions that we see as pediatric surgeons, varying from sort of the mundane, such as appendicitis, all the way down to very serious congenital disorders that some kids can be born with. That, unfortunately or fortunately, I've had to put on the back burner because I'm not physically at UCLA anymore. Armenia-related research is still very much active. I guess there are two different tracks that can think about. The first one is if a trainee has some interest of their own and they need a research mentor or they need someone to help line things up for them. And I'm happy to either find someone or be that person. An example of this would be a medical student a few years ago from UCLA, Leolia, who is very interested in doing diabetes research in rural areas of Armenia, something which a surgeon, pediatric surgeon no less, would have very little to do with. But we were able to get that all lined up, and she had a successful research experience here a few summers ago. My personal areas of research are very much active. We've sort of taken a big interest in the sort of doing a lot of the different investigations that would need to be there so that we can ultimately come up with good national cancer screening programs. So you mentioned one, Rafiq. We've done some research with colorectal cancer screening, but that's also sort of branched out. We now have a team that's working on lung cancer screening in Armenia, and a newer team that's working on cervical cancer screening. We have some ongoing research on breast cancer screening. So all of these, as you may or may not know, not surprisingly, cardiovascular disease and malignancies are the biggest contributors to morbidity and mortality in Armenia. And of course, many of these can be prevented on the cardiovascular side through good, reduction of risk factors, as well as early management and treatment. And then on the malignancy side, the cancer side, obviously, many of these cancers can be prevented or caught early with appropriate screening, which we don't have here in Armenia. So we've sort of taken emphasis, or we've made these the areas of concentration for research. But that's not to say that anyone's passionate about or interested about something else who doesn't have an opportunity to be involved in research here. What else on the research side? Does that answer the question, or you want to?
I'm interested in like palliative and hospice care, and I know it's the DNR thing is not really a thing in Armenia. We had a friend, my friend's grandpa was sick, GI bleed. I mean, they didn't want to intubate him, but he literally had to be on the phone. Like we were on the phone with the ICU attending there, saying, "Do not intubate." Like I was giving like morphine drip orders through the phone to Armenia, and I realized that that's a huge gap that we have. That's why I was tuning in over if there's any way for me to have a mentor or somebody that you know could kind of start developing palliative hospice idea, because I feel like that's just one thing that's seriously lacking as well.
Yeah, it's a certainly lacking. It's a, I would say, a difficult field to try to make some changes for a couple of reasons. As you can understand, there's a lot of cultural issues that come to play here. I don't think we would be ready for palliative care the way we see it in our hospitals in the United States. The other issue is because during Soviet times, narcotics were so heavily discouraged and so difficult to get a hold of that many of those rules are still there. And so there's now some attention being paid to palliative care. There's some palliative care centers that are being opened, and one I think is being built at the adult oncology hospital, another one that's being built at the pediatric oncology hospital. But the more, beyond the buildings, this notion of liberal usage of medications that otherwise we use in a controlled fashion is still very, very difficult to do. The access to narcotics, the ability to prescribe large volumes are very, very limited. And so the question is what type of research or what kind of project one would want to do, and whether the focus should be on advising so that the policies are better, or more on the ground sort of development of palliative care programs. But the caveat there is that you can develop the nicest program that you want, but ultimately, if there's not enough morphine, literally not enough morphine in the country, then you are not going to be able to have any palliative care program, right? So it's a tricky one. It certainly needs to be addressed, but I don't know how one can make good advances in that area without having the policies and sort of the state level interventions that need to happen before one can set up a really good on the ground palliative program. So maybe for that one, I would encourage some assessment of how other former Soviet republics have transformed their drug policies to allow for these types of programs to build as a first step before thinking about having, a hospital have a better palliative program. Because again, I think we're still a little far away from that. I'm happy to chat about this more with you, Rafik John, on a one-on-one at some point. There is, just as a background, you guys may have heard, the diaspora office here has launched a program called IGORDS or IGORDS. It allows for people who have graduated, I think probably after a master's level degree, to spend a year here and spend some time within government structures in Armenia. So one of the IGORDS participants at the Ministry of Health, her name is Tamara Tatevosyan. She's from Philadelphia, but she's actually been doing a lot of background work on policies and legislation as it pertains to palliative care. So for you or anyone else that may be interested in that, I can connect you guys and see how far she's gotten and what progress she's made and where the issues lie there right now. Hey, we have a Bruin in the room. All right, nice. At least one. Is that right? A medical student from UCLA. Want a hand up? Nora, hey.
Hi,
you're
thank
muted.
you so much for taking the time to be here today. So I have two questions. First, I'm an incoming first-year medical student at UCLA, and I know we have like a discovery year incorporated into our curriculum. So in our third year, we could do pretty much whatever we want, and there's like a global health pathway as well. I am aware that there are a few active partnerships between UCLA and Armenia, and you briefly touched on a few. I was just wondering about how active those projects currently are, and whether there's any community-based participatory style of research where you have community leaders who are interacting between what the people feel are the most important research topics, people living in Armenia, instead of us assuming what the problems they face are. So that's my first question. And then my second question is more so related to cultural perceptions of preventative care, and whether you feel that has played a role in whether Armenians seek out certain necessary healthcare treatments.
Nora, I lost you a little bit. The internet was spotty here. You were asking about community-based research, but maybe if you can repeat the last 10 seconds of your question so that I make sure I understand it.
Yeah, I just wanted to know whether there's any active community-based participatory research where there's community leaders who are identifying what they feel are the biggest parts of quality of care that need to be improved in Armenia, instead of us from the diaspora assuming what the problems are. And I know that there's some partnerships between UCLA and certain hospitals in Armenia already, but how active those projects are and whether they use that sort of modality of research. And then the second question is more how you feel the cultural perspective on preventative care plays a role in whether people seek treatment. Just having worked in a primary care clinic this last year in Glendale, where most of my patients are immigrants from Armenia, the perception of preventative care, I realized, played a pretty big role as to when they would come into the office and how well certain chronic diseases were managed. So I just wanted to kind of ask about that as well.
Okay, great. So community-based research, definitely happening, definitely an opportunity and a role to continue and to do more of that. Two of your classmates have applied for their Discover Year to be here in Armenia. One of them, Emily, is going to be working on a pilot program in Lori region in a primary care clinic to assess some new models of care that are being implemented there that include a bigger scope of care by primary care providers. So here in Armenia, again, going back to that Soviet legacy, a primary care doctor, a family medicine doctor cannot diagnose, for example, or treat diabetes or hypertension. They get automatic to an endocrinologist or a cardiologist, which obviously doesn't make any sense. It's not cost effective. It's just not a sustainable way of delivering care, quote unquote, on the front lines. So we're working on changing those components of primary care delivery, and Emily is going to be working with this particular village in Lodi to do that kind of stuff. I do want to add something though about sort of, first of all, community-based research can mean a lot of things. There's absolutely a need for better stakeholder engagement, both research and in both policy making. Unfortunately, but not surprisingly, again, sort of given the Soviet legacy, so many of our changes and interventions have happened with a very top-down heavy approach. Decisions are made without really getting stakeholders, from the patients to the providers to the community at large to churches, whatever makes up our society. And that's one of the things that we excuse me, have highlighted in our primary care reform strategy, that we need much better and more effective and also objective stakeholder engagement, so that there are also not conflicts of interest when various people get engaged. However, there has to be a balance, because when we look at, for example, on the provider level, when we ask providers and hospitals, what are your needs in order to improve quality? The answer always inevitably will come back to, we need more supplies. We need a better building. And there is still not this widely disseminated concept, where, again, there's plenty of literature on this, that more equipment and more supplies has very little to no correlation with improved quality of care. So I think stakeholders and communities absolutely need to be involved in both planning for and implementing interventions, but even that needs to be framed correctly. And we also need to follow evidence-based approaches, evidence-based interventions, which may sometimes not be, and particularly in Armenia's reality, not be readily accepted initially. But it's not that much difference in other places. Screening, for example, even in a lot of outside of Glendale, more quote unquote American parts of America, it's not like there are 100% uptake in screening programs in name a city, Nebraska or something like that, right? But it's still better than the zero or the near zero that we have in Armenia. So it's about setting realistic expectations. It's about making sure that we focus on cost-effective interventions that address a burden of disease. That's the other thing that we oftentimes get into. We get into the weeds, and we have beautiful programs in Armenia on a zebra disease that there may be 3 or 4 or whatever, say 10 people in Armenia suffer from. But then nobody's talking about hypertension and the fact that 84% of hypertensives in Armenia don't have their blood pressure controlled. And the fact that simple, inexpensive beta blocker medications, which we all know is like the baseline staple of managing hypertension, is not readily or freely available to the population. So I think you're absolutely right. The component of bringing in communities, effective stakeholder intervention is very, very important, but it needs to be balanced by having an overall national vision that addresses the main burdens of disease and where we are going to get the biggest return on investment, not financial return, but health return on investment in whatever intervention that we're doing. I talked so long, I forgot the second part of your question. I don't know if I addressed it in there or not.
Well, thank you. That was very informative. The second part of my question was whether you feel our cultural perspectives on preventative care play a role in how early on or how often people seek treatment. Like you mentioned hypertension, and just working in the clinic last year, a lot of my Armenian patients said, I feel fine, so I don't really understand why I have to take this hypertension medication. And often they don't feel that their blood pressure is high unless it's going through the roof. So just whether you feel that cultural perspective plays a role in what we can sort of do from the health literacy side of things as well.
Yeah, so I think you nailed 2 things. Actually, health literacy is a huge challenge. We've often prided ourselves as Armenians as being one of, a nation with one of the highest literacy rates in the world. But that doesn't, that means that 97% of the people know how to read and write. But health literacy is a totally different thing. And I don't know if anyone's assessed it, but my guess would be that we actually struggle with having a population that has high enough of health literacy. The cultural aspects, absolutely there. But they are also there in South America, in Southeast Asia, in Sub-Saharan Africa. Yet many programs and policies have been able to be implemented successfully in those places, taking into account the cultural aspects and developing interventions that are able to overcome those. And again, it's about setting realistic expectations. We're not going to go from a society that we weren't even able to achieve 50% COVID vaccination rates. We're not going to go from that society to being one where every single healthcare recommendation is being adhered to. But we should have that, again, out and identify where are the 1, 2, and 3 main pain points. What are these cultural barriers? How do we overcome them? Who's going to overcome them? In some societies, it's the church, it's the faith-based approach. In others, it's purely scientific. In others, it's right combination in Armenia. So this is a huge area of research. Obviously, we don't think about it often as clinicians or healthcare people, but there are some frozen faces. Can you guys hear me now or no?
Yeah, I'm sorry, you cut out towards the end where you were saying that.
Sorry.
You were saying how we don't often think about these things as clinicians, but, and then you cut out.
Yeah, we don't often think about it, but it's a fascinating area of both research and an area that we need to develop and into all these interventions that we're making so that we can do things more effectively. I think I was going to just say that one of the UCLA students who's interested in doing their discovery year has a background in medical anthropology. So we're anxiously awaiting her input and arrival and thoughts about how to sort of overcome some of these barriers that you talked about now.
Thank you. Thank you for answering my questions.
Mm-hmm.
There's a question in the chat. I'm not sure if you can see it, but it says that, do you think doing mission trips like medics in Armenia are beneficial for those who are in pre-med?
I think I'm just going to, before we have issues again, I'm going to switch over to my
recording in progress.
Okay, can you hear me now? Hello?
Yeah, we can hear you.
Okay, there should be a more stable connection. Question, do you think mission trips like medics in Armenia? Okay, so let me just give a disclaimer. I have a pretty strong bias. I think I already mentioned it. I am not a big fan of medical missions. I don't think they do much to help address any of the issues that we have in healthcare in Armenia. But the caveat is, and Siret, I think, phrased the question very well. If you are on a path to one day having a more sustainable and impactful involvement in healthcare in Armenia, then these types of trips can be beneficial in getting you exposed to and introduced to the healthcare system in Armenia, making the connections with the people that can ultimately be your partners, and helping for you to have firsthand sort of knowledge and experience with some of the systemic issues that you can then think about tackling once you have more experience, we're further down in your route in your career, and are able to dedicate some more time to it. So I think one of the silver linings of these quote unquote medical mission trips is that it does provide this opportunity. But what I wouldn't want, what I would strongly encourage you guys to do or not to do is to see the repetition of medical missions as your involvement in healthcare in Armenia, because I think that is, I mean, it's not a matter of me thinking, there's absolutely no country in the world who has been able to sustain or improve their healthcare system because a bunch of people come in for a couple of weeks and then they leave. So we're, you know, and we don't need it. Like I said before, this isn't 1992 Armenia when the Soviet Union collapsed. We didn't have dialysis machines and there were no surgeons in the country and there was war and earthquake. Then it's just not the Armenia that we live in right now. And so our interventions and our projects need to be planned appropriately. But again, an opportunity to come here, and that's what I did. Every single time I had vacation and I had an opportunity, I flew out to Armenia. I never was part of these medical missions, but it's okay to fly out with them or come out with them. It's a little bit more organized, but just expose yourself. Any article that came out that had anything to do with healthcare in Armenia or another successful global health intervention somewhere else, I would read it. Like I just incessantly read all these, like a nerd, all the WHO documents on healthcare in Armenia and the World Bank documents. And then I would just come and like totally uninvited, just go to the hospitals and watch and observe and participate. And then all those people that I did that with are my colleagues right now, and are the people that um, are crucial for me being involved in healthcare in Armenia. So from that perspective, you know, I think they provide a good opportunity to be exposed to healthcare in Armenia. I do now see another question. Are there any projects in Armenia you've worked on that you are particularly proud of or found the most significant? Yeah, it's a good question. I like being challenged by such questions. I think while I have no concrete thing to show for it, like it's not like I've now been here for 8-9 months, and I don't know, there's a 90% improvement in breast cancer screening or something like that. But I think the thing that I guess I would be most proud of is the fact that I am now here on the ground, embedded within the Ministry of Health, and able to sit on the table with the policymakers. And all of those years of doing research and getting a master's in public health and having an experience working at various hospitals is now contributing to the development of or contributing to the making of day-to-day decisions that are altering or affecting how our healthcare system works. Is there going to be one thing at the end of our little experiments and our little stay in Armenia that I can look back and say, hey, Shant did that one thing? No, and it's not really an expectation or an ambition of mine. I think I firmly believe that each and every one of our roles is to just move that needle just 0.001 degree. But there's enough of us that ultimately that we can turn the whole ship 180 degrees if that's what we need to do. And for me, it's all about being a part of that team. It's not about saying, I'm the one that moved that needle the most. In fact, sometimes I'm afraid of that, because sometimes we move the needle the wrong direction. So just being a part of the team, I think, and being able to have this opportunity and building up to this opportunity and making, small decisions. I feel like I'm being a part of small decisions. I feel like sometimes I've been around the table and spoken up, and something that could have potentially been a devastating decision or a devastating way to go in terms of policy, I was able to stop. Or conversely, nobody was talking about the fact that at the Ministry of Health, yet another article was published that showed that road traffic accidents are increasing in Armenia year after year, right? And so probably if I wasn't on that table, it could have been, just there's so many other things that are happening. But because I was there, because, this came across, and because I had the opportunity to be around that table, I brought it up. And now we have a task force that's looking to see what, if anything, we can do to address this problem. So just being part of this bigger team. And then, clinically, I've done some stuff which I wouldn't say I'm proud of, but I have been in, for example, before a few years ago, kids who were getting chemotherapy did not have sort of the standard of care in terms of access so that their medications can be given. So every time they came in to get their medications, they would have to get an IV placed without any sedation, and it was traumatic and all this kind of stuff. But we were able to start a central venous access program for our oncology patients, and now all of the patients have it, and they get their infusions with this long-term IV catheter that we as surgeons get to put in. And so they come in and don't have to go through the trauma of the needle sticks every time, because they have this long-term access. And so clinically, I've been involved in that. I've been involved in setting up a short bowel syndrome program here in Armenia, which is another thing that's relevant to my clinical field. So a bunch of stuff. I can't say that there's something that wow, Armenia's healthcare system is so different because I've been here. But again, for me, it's not about that. It's just a part of being the team. Do see Manuel with a hand up.
Hello. So just you speaking about it has gotten me to think about it a little bit more. And you mentioned it very briefly for like a second, but I'm a public health major at UCI, along with a couple other people here. But one thing specifically for me, obviously medical school is my goal. But I've gotten very interested in sort of public health, the policy side of it within my courses. So I've been considering going or doing an MPH before medical school. But I just, individuals or what I've read online, a lot of people sort of don't like that idea or say that it might be a waste of time to do MPH. But I mean, sort of hearing you speak and hearing about creating these policies and working on reform, it makes me want to do it even more. So what would your advice be on something like that?
The movers and shakers of reforming Armenia's healthcare system, by far, the overwhelming majority are masters in public health people or MD, MPHers, hands down. I don't even know which example to start off with. Arusik Harutunyan, MD, MPH, has single-handedly did all the background research and wrote the policies for tobacco control in Armenia. And now we get to go to restaurants here in Armenia without anyone smoking. And it's going to have huge effects on sort of downstream negative sequelae of smoking. Kim Hekimian from Columbia University now, another public health specialist, single-handedly dramatically changed the rate of exclusive breastfeeding in Armenia, which after the collapse of the Soviet Union was unfortunately very, very low. They would supplement with cow's milk and or just regular water. And just her one single program was able, I don't want to quote the numbers, but dramatically change those practices and have a lot of women go back to exclusively breastfeeding, which again, tremendous downstream ramifications of that. Medical school and medicine is about treating the patient. Public health is in the name. You obviously get a tremendous amount in terms of skill sets and a perspective by pursuing further sort of education and programs in public health. To me, so I did a master's in public health, and it wasn't so much that I learned how to do statistical analyses better or anything like that. It was all about changing the perspective of my mind and understanding that healthcare is not about treating that one person, which is my day job as a surgeon. When you walk into the hospital in your scrubs, your one and only responsibility is to make sure that the patients on your list get the best, most aggressive, everything that we can do for those 3-4 patients. Improving a healthcare system, shaping the future of a national healthcare program is a completely different perspective. And that's what the public health program gave to me. It wasn't that one thing that I'm now able to do better. It's just an outlook that was different. So if you are willing to invest and learn and read and try to understand that perspective, I don't necessarily think that everyone needs to actually go through 1, 2, 3 years and get a master. But of course, going through that standardized program will do it automatically for you and then also give you some additional skills. So to me, it's more about the public health hat, wearing that and thinking along those lines. But again, the formal education can only help. And it depends on what interests you the most. To me, I just saw Armenia's healthcare system as a major challenge that I wanted to be a part of. And for that, the public health background has been tremendously beneficial.
There was a question from someone who had to leave, but she said, how often do you see speech and language pathologists if you do in pediatrics, and if you feel like they need more in hospitals or in private facilities in Armenia?
Yeah, so make it more of a blanket statement. All of these non-physician providers in Armenia, trying to make it as generic as possible, starting from nursing and then going down, not down, but going wider into physical therapy, speech therapy, psychology, are incredibly underdeveloped in Armenia. Some of them also, to make things even more challenging, such as speech therapy, are not even under the, for example, the education comes from the schools of pedagogy, or I don't know how to say that word correctly, rather than the School of Medicine or School of Health Sciences. So they even come from a different non-clinical branch, which makes things even more challenging. But these are all areas of the healthcare system that absolutely need to be developed. But there's a challenge here, right? So yes, we don't have speech therapists, but then we don't even have good nursing programs, right? So which one do you start with? If you're agnostic, you don't have a passion, and you look at the numbers, again, obviously, maybe not obviously, but probably the biggest return on your investment would be if you can improve nursing care in Armenia. So that's one approach. Again, if you're not passionate or you're not a speech pathologist yourself. If you are, then you feel compelled to improve your own field and your own sector. And there is someone actually from the area that's done a fair amount of work in this field, Lori Pogarian. So there is an opportunity to help in that field as well. But just generically speaking, these, maybe the correct word is allied health professionals. All of these fields are quite underdeveloped in Armenia, and very much in need of improving and developing further.
Hi, I had a quick question about the stat that you kind of talked about in the beginning that was honestly pretty alarming, the one about more patients dying because of the care they receive in Armenia versus the accessibility of care. What do you think the big reason is for that? You've talked a lot about the lack of a primary care system that might lead to mismanagement of diseases and conditions. You talked a little bit about some hesitancy with accepting evidence-based medicine practices that might change standards of treatment in Armenia. So what do you think the big cause of that is, and how could we help to address that, at least knowing that things like medical missions aren't really fixing these issues?
Yeah, thanks. This was Christopher, I think. Thanks. Really a tough question, actually, but I don't know if I have the answers really well drawn out for you, but I would start by saying it's multifactorial. We have, if you look at, what are the components of delivering high quality care? Well, there's a few ways we can look at it. In fact, the founder or the father of healthcare quality is an Armenian, Avedisto Nabedian, and he proposed that there's a triad upon which quality of care, healthcare quality is delivered. He broke it into structure, processes, and outcomes. So structure are the people and the buildings where healthcare is delivered. Processes, it's just that, right? How do we, how much antibiotics do we prescribe after a surgery, right? And then outcomes is again just that. So if we start from structure, we unfortunately have a fledgling medical education system where the quality of training and education in health or medical school is subpar. So that's one area that needs significant attention. What about the physical structure of healthcare in Armenia? Well, let me give another incredibly startling statistic. We know that quality has a very strong correlation with volume. All of us as providers or all of our institutions are good because they have enough volume so that they can maintain their competencies, maintain their practices, justify investing in more and more equipment or technology, and then ultimately deliver better and higher quality care. So volume equals quality. In Armenia, Yerevan, in the population of 1 million people, there are 41 hospitals. There's not a city in the world richer than us, bigger than us, geographically more wider than Yerevan, that has 41 hospitals for 1 million people. The right number is probably on the order of 4 to 8 hospitals for a population of 1 million, or the geographical size of Yerevan. So how could you ever assure that one doctor in that one of the 41 hospitals in Yerevan can have enough patients and enough volume to have high quality care? You can't. It's impossible. And then on the system level, how can a country with a Ministry of Health as small as Armenia be able to oversee all of those doctors in Yerevan? The number of which is twice as many as most European physicians per capita statistics. Or how could they oversee all of those hospitals in Yerevan when they probably have the bandwidth to oversee or regulate 4 to 8 of those hospitals, which would be the appropriate number? So we have huge issues in that. And then we can go into the processes, right? Again, do we have the proper protocols to assure that we're not abusing antibiotics? The answer is no. Do we have the proper ability to make sure that various medical processes are done correctly or optimally? And the answer is no. Do we have quality boards or quality officers in hospitals? And the answer is no. And then finally, because of this, we get the outcomes like the big one that I mentioned earlier that we do. There's huge issues with misincentives or malalignment of incentives for overutilization of healthcare. Another interesting statistic, or an impressive statistic, and we've all lived now through 2 years of COVID. I'm sure you guys have had at least, 20 people that you know that have had COVID, of which probably 0 or 1 of them got a CAT scan. Here in Armenia, most people, well over 90% of patients with COVID, even though they were feeling totally fine, got 1, 2, or 3 CAT scans, which is obviously very poor quality care. But because the whole system is not well regulated, because of the health literacy issues that we talked about, there is an extreme overutilization of healthcare, which leads to poor quality of care. So now I've just made the situation a lot more complex probably, and then we're going to have to transition. I have to answer your question of how can we get involved. So very, very challenging to do so. First thing is to understand these issues, to take a deeper dive, to understand the root causes of it, and then to participate in some research or try to do some research that helps either further understand, or in a pilot or a small scale setting tries to address some of these issues. What could that be? Antibiotic stewardship program, for example, in a hospital or 2. Assessing the reasons for admission among children in Armenia, and publishing the data that shows that so many kids, for example, in Armenia get admitted for ear infections. You guys have nieces, nephews, little younger siblings. None of your relatives have ever been admitted for an ear infection, right? But we know that that's a problem here. But we know it because anecdotally we know it. No one's actually published that so that it could alert people to do either further research or to do more policy interventions. So being involved from that, and then ultimately develop or implementing or designing programs that can address these types of issues would be the way that I would encourage all of us to proceed. Not an easy thing to do. It would be so much easier for me to stand in front of you guys and say, guys, let's all just come here, rack up your vacation time, come here, volunteer in the hospital, whether it's wheeling patients around or whatever it is. But, I think for me, it's important to sort of iterate and reiterate the point that none of that is going to help us address these big chronic challenges in our healthcare system. So number one, talking about them openly, learning about them more, and then thinking about how we can develop long-term projects to address these issues is the way to go.
Thank you for that. I mean, it's really
Yeah.
interesting to think about. I mean, like you said, most people think that it's an accessibility issue, but to kind of hear that it's like almost an overuse of the healthcare system instead is honestly quite alarming. And I was wondering if there's like, I mean, now I'm living on the East Coast for medical school, and there isn't really anyone or like much of an Armenian community for me to reach out to here in terms of trying to get involved in this way. So I was wondering if there's any like names you could give or places we could reach out to kind of get involved in research like that.
Yeah, where are you, Christopher?
I'm living in Virginia right now for school.
In Virginia. Yeah. Okay. So we have a colleague in Virginia who's fantastic, Aline Baldasarian. She's done a. I'll talk about this. By the way, do we have a hard stop time here, guys, or what's our situation?
We
like?
usually end at 11, but if you are open to like speaking or staying on a bit more, like that's totally fine. It's like totally your call.
Okay. So I'll just give the little story of Aline, but I would say sort of, yeah, there are people up and down the East Coast. Aline comes to mind because she's in Virginia. Kim Shekherdimian at Columbia University is absolutely fantastic in mentoring public health and medical students. So I would urge you guys to also reach out to her. Sam Badalian in New York is a Fulbright scholar who is working on maternal mortality and OBGYN issues. Sharon Shekherdimian up in Yale is working on reforming or developing an emergency medicine program in Armenia. So there's a whole bunch of people who are involved, but I'll tell you a little bit about Aline's story because I think it'll help answer the earlier question that you gave as well about how do we get involved. Aline is a pediatric emergency room physician who came to Armenia during, I think, your residency or her fellowship for like a 2-week trip, and she did a very, very simple research project. She developed a survey to assess the knowledge of emergency physicians. Here in Armenia, emergency or ambulances have physicians on them. It's like the European model, not the American model. So she surveyed all of the ambulance physicians in Yerevan about their knowledge of basic pediatric resuscitation. So these are, it was a 10-question survey asking about like, how do you do CPR, basic dosing of epinephrine, sort of bread and butter of what one would imagine you would need to know if you're going to be a frontline responder to pediatric emergencies. And then her data showed, I think 88% of the respondents actually failed the 10-question survey, did not know basic pediatric resuscitation. So she published this. And then with that publication, she got a grant. I can't remember the exact amount of the funding. With that grant, she was able to come here for 3 or 4 years. And every year she put together a 1-week seminar for pediatric emergency care, bringing faculty from her institution, from Canada. I would teach the trauma and surgical aspects. And we would have this for 3 or 4 years. And then she collected data again, and she showed that that number had improved significantly. And then she came back again and she published, and she showed that even a year after the course, there was a small drop, but there was still a significant retention of that knowledge. And then with each one of these publications, she got further and further, or she got more and more funding. And then she was able to finally do a training of the trainer, a TOT course, where she took the best performers from all of these years of training. She then made them the trainers. And now this program has run for, I guess my first time here was 2014. So it's been going on independently of her coming to visit. And it's become a sustainable model. So any one of these problems or challenges that we see, and I really like telling the story of Aline because I think she sort of perfected it all. She went down this path in an academic fashion. She didn't just come in willy-nilly and say, hey, I think ambulance doctors are terrible. I want to do something about it. She actually proved it scientifically, just like we would if we came up with a new headache drug or something like that, right? She proved it. She published it. She used that publication to get funding. We didn't go back to the same Armenia Fund, Armenia Relief Society, knock on the same doors for money. She got money from her institution, American US institution, to do this project. She got her colleagues on board. She then showed that her intervention was effective. She then came up with a transition and sustainability plan. Along the whole way, she involved trainees. She published, and she packaged it in a very nice way. So I think it's a great story of how we can think about how to sort of formulate a plan with regards to doing various interventions in Armenia. I'll stop with that. Aline Baldasarian, if you want to look her up on PubMed, all of her publications should come up. And then maybe that's a good way of transitioning to Nora. I think Nora, she was also on a paper that myself, herself, and Christopher Markosian from the East Coast, who's a medical student, I think at Rutgers, or somewhere in New Jersey. He wrote a paper on mental health issues in Armenia following the Artsakh war. I think I'm actually confusing two different papers. Aline was on that one. Anyways, large majority of the past year, what sort of immediate and suspected long-term effects do you feel the 2020 Artsakh war population health for you? Population immediate effective direct. Yeah, so you've done the research, and obviously anecdotally on the ground, it's undeniable that there are, the pandemic combined with the war have had huge effects on mental health and use a more generic word, the psyche of people. And that has its effects on healthcare utilization and seeking behavior. I'm not a mental health expert. I'm actually very intimidated by this area. Nora, it seems like you have a very different perspective and have an interest in looking at not so much the sort of direct healthcare interventions, but looking at these cultural aspects, the mental health implications of things, which is absolutely fascinating. We need more of you guys, and we need more of you guys to bring in, even in those fields, the scientific approaches, because we know, for example, that mental health issues, actually, I think it's the second or third highest contributor to morbidity in this country. Obviously not mortality, but morbidity. But I don't know, as a public health person or as a clinician, I don't know how do you intervene on these things. To me, it's so much easier to set up a cancer screening program because I know how you do that. You buy the mammogram machine, you pay for the Medicare, for the exam, you get a good radiologist, and boom, you have a breast cancer screening program, right? But how do you address these mental health issues? So much of that to me seems to be outside of what we can do in healthcare. Obviously, the economic situation of the country, the national security issues, these all factor in into these things. But I believe, in my cursory knowledge, that even within those, there are cost-effective and there are effective ways of having different mental health interventions. It's just so beyond my areas of expertise and knowledge that I oftentimes am shy to even approach them. But there are people that work on here. There's a couple of our colleagues at UCLA, actually. Valentina Ogarian is someone who's very, very interested in mental health. She's a psycho-oncologist at UCLA. She was just here. She's involved in various programs, from psychologist training to, during the war, she was involved in this thing called PFA, I think, psychologic first aid. So they did a lot of training programs on that. If this is something that interests you, she may be someone who has a lot more breadth and depth of knowledge of this field than I do here. Do you feel it is being addressed currently? Are there other impacts that we may not as well? So is it being addressed effectively? Probably not. But again, I'm not the expert at this. Are there other impacts? Probably but I don't, well, I mean, let me just talk about it. Just an hour before we got on this call, there was a huge sort of march that went up the street in this window that I'm looking at right now. And this is what people are seeing every single day. Yeah. And again, I'm not to justify or unjustify the political sort of things that are happening in Armenia, but living in this reality where, to put it very briefly and bluntly, people here just haven't been able to catch a break since independence, right? I mean, we've had war, we had the collapse of the Soviet Union, the earthquake, then we had the years of corruption and injustice, and then we have the other war, and then we have pandemic, and now we have political instability and turmoil post all of this. And so undoubtedly there's huge mental health ramifications of all this, but how to unravel that big elephant in the room is a challenge for me, but certainly an area that we need to address. All right, we are past the hour. I'm happy to stay on as long as you guys want, but I also want to be mindful of you guys' Sunday. So,
Dr. S, I had a quick question.
yes.
I was wondering, I know with the protests that you mentioned, I'm sure that hinders a lot of emergency medicine treatment and people that need to get to the hospital urgently. And I actually know of someone that had passed away because they weren't able to get to the hospital on time. But in regards to that, I know with COVID, a lot of the primary care, health professionals transfer to a telehealth sort of based method. Would that be effective in Armenia at all? Or what's the approach that could take place with that?
So we've talked a lot about utilization of telehealth. I think it's before we dive into it, I think we first need solid foundations for it, some solid policies, so that we get it right. And we do things that we are able to monitor, regulate, that are integrated with the medical record system, that we don't have people doing cavalier things that shouldn't be done remotely, and that people don't see it as a replacement for physical visits. For example, in my field, in pediatrics, right? One of the important things that we need to do after a baby is born is check their weights and make sure that they're doing well on their growth chart, do a vision exam, right? And so we want to make sure that we are introducing telehealth or mobile health appropriately, but they are not seen as a replacement for some of the other things that need to be done. We don't want the population to think, oh, I just talked to my doctor last week on Zoom. I'm done I don't need to go get a colonoscopy. I don't need to go get a mammogram. I've checked off that box, right? So we need to make sure that the models exist, that the template exists, and the policies exist for all this. But of course, medicine is going this way. COVID, totally accelerated the role of virtual care, and we should be using that particularly for our rural areas. But it needs to be designed well. It needs to be modeled well. We need to have the right policies in place before we let the whole system run loose with it. So another area, fantastic area of research, where what have been the right models? Where are the right areas for implementation? How do we implement them? As we start to expand the scope of the primary care provider, right now our primary care facilities include having a cardiologist, a neurologist, an oncologist, an orthopedic surgeon in every single primary care. They're called polyclinics here, right? We don't need those. We don't need that huge structure in a place that only has 2,000 people, for example. So as we expand the scope of the primary care provider and the cardiologists and the neurologists, quote unquote, downsize or centralize more into the bigger cities, how can we provide cardiology care via telemedicine effectively? What are the best practices? What are the evidence-based uses of cardiology telehealth, for example? These are all things that we need help, we need people to research, we need policy recommendations for these. So all areas that people like all of you can be involved in.
Thank you.
You're welcome.
I just had one last
One
quick
thing.
question, if that's okay. So I'm
course.
minoring in global health, and a requirement for me to get that degree is to do a year-long capstone project. And I did want to focus my like research on healthcare in Armenia. Is there like a specific field of that that you would recommend like a greater focus on, rather than just like a broad sense of global health in Armenia?
There's no area that's been over assessed in Armenia. And so literally everything is at your disposal. I don't think that there's one area that you can look at and where people would say, oh, we already have all the answers. I would say, to me, I would ask, two questions. Number one, is there something you're passionate about? Because if there is, then you should pursue that. If not, or even if you are, but you can't find the right fit for it, look to see where the burden of disease is. Look to see where the priority areas in healthcare are. To me, I would love to be spending every single day here thinking about doing and improving surgery. That's my specialty. That's what I've spent, whatever, I don't know, decade and a half training to do. But I recognize that today, for example, primary care or quality of care, as we described, or cardiovascular disease or oncology are far more pressing issues than developing a, neonatal surgery program. So find areas where there's biggest return on your investment with whatever work that you're doing, and try to hone in on that. So again, if I had to directly answer your question, looking at various components of primary care, one of your colleagues mentioned mental health. So huge area. We talked about road traffic accidents. We talked about oncology. These are the areas where I feel like we need to make our biggest gains. And then also, what interests you? Some people, I think someone mentioned that they're very interested in policy. So you don't have to do something that is more clinically oriented or that's more medically oriented. If you're interested in that, if you're interested in sociology, for example, how do we improve health literacy? If you're interested in biotechnology or just tech in general or engineering in general, how can we improve or optimize our blood bank program by using drones, for example, that they use in Somalia to get blood to remote hospitals, whereas here we don't have a centralized blood program. If you're interested in economics and business, we have huge issues in pharmacy in pharmaceutical industry, for example. How can we develop the centralized procurement program? What are the best models for that? Maybe thinking about sort of new models of quality in pharmacy. So it doesn't have to be that classic, medicine, public health. Let me try to, design a program that, passes out toothbrushes to kids in villages. It's important. Dental hygiene is important, but if that's not your interest, if your interest is in something else, in marketing, in again, engineering or technology, marry those two things. There's so many opportunities to do things.
Thank you. And are there any more other questions for Dr. Shant? Okay, if not, then we can just end the meeting. Thank you, Dr. Shant, for taking the time to come and speak to us. I really enjoyed everything you talked about and all the pointers you gave.
You're quite welcome. I'll just type my email in here. I can leave my number too, but here in Armenia, it's only available through WhatsApp so feel free to shoot a message or email at any point. Good luck. I look forward to hearing about all of you guys' successes and seeing you here in Armenia.
Thank you so much, Dr. Shant.
You're welcome.
Bye bye.
Bye-bye.